Now at 4:30, a new study about marijuana edibles is making the headlines around the country and here in Western Mass. That study shows a sharp increase in emergency room visits in Colorado after people consumed too much marijuana, specifically from edibles. Western Mass News reporter Caroline Powers spoke to local doctors about the impact it's having here. Caroline.
Jeff, emergency room doctors at Bay State Medical Center say they've seen an uptick in people coming to the hospital after consuming too much marijuana through edibles. Dr. Gerald Beltran is the chief of pre-hospital and disaster medicine at Bay State Health. He tells Western Mass News more patients are coming into the emergency room after overdosing on marijuana.
We do see an uptick, and it tends to be often related to edibles because the way edibles create the intoxicating effect tends to take longer with the edibles versus the inhaled. And people think it's just the same as the inhaled, expect the effects to be 15 to 30 minutes, where it tends to peak with the inhaled, while the edibles, it may be anywhere from 30 minutes to 4 hours before the peak effects occur.
Dr. Beltran says there are a number of different side effects.
Anxiety is one, tachycardia, meaning your heart beats fast, dry mouth.
A new study published in Annals of Internal Medicine found in Colorado, edibles make up less than 1% of the total sales of marijuana products, but they are linked to 11% of all emergency room visits, a number that has been growing year to year. Here in Western Mass, dispensaries like INSA say edibles make up about 10% of their sales. Lucas Wiggins and Audrey Park are co-founders of Hot House Holyoke. They are working to make gluten-free edibles they can wholesale to dispensaries. Their advice to new edible users: start with the lowest amount possible, like 5 milligrams, and wait a good hour before consuming more.
As people, we're naturally impatient, so we're like, I'm not feeling something, my body's different than other people, I can just take more, and it's easy to fall into that trap and that mentality. And the warning is true. It's you got to start low and go slow.
If you have any questions about it, definitely just ask the people at the dispensary. They're well trained on this kind of stuff, and it's kind of fun to talk to someone who's new to it about it. So definitely don't hesitate and ask questions.
And Dr. Beltran says children are a big concern too because they see things like chocolate bars and gummy bears and think it's normal candy. They may eat it and their smaller bodies can't process it, causing them to overdose much easier. In the studio, I'm Caroline Powers.